The CDC, along with local doctors, say it's important to get a flu vaccine. I'm Kirsten Joyce.
And I'm Brian Loftus. 8 News Now reporter Kate Houston breaks down how the COVID-19 pandemic will potentially impact our flu season and how to keep your family safe.
Doctors are urging everyone to get a flu vaccine this year. They worry that a spike in flu patients on top of the pandemic could overwhelm hospitals across the valley.
Starting in September or October, the CDC recommends everyone 6 months and older get a flu vaccine.
Certainly kids, anybody, high risk, people that have comorbidities, certainly healthcare workers, teachers, people that are around kids, they should all be getting vaccinated.
Not only is Dr. Clarence Dunnigan with Mountain View Hospital worried about flu and COVID patients overwhelming the system, but he says patients could get both at once.
If you get COVID and influenza on top of that, I think there's a potential for you to be much worse with the combination.
In an effort to get everyone vaccinated, manufacturers are projecting there will be nearly 198 million flu vaccines available this season. That's more than the record 175 million doses last year. The CDC is also purchasing an additional 2 million pediatric vaccinations and nearly 10 million for adults. While COVID-19 and influenza are different viruses, they present many of the same symptoms. In some cases, testing may be needed to confirm a diagnosis.
It is confusing for us to have people with both the flu and COVID with very similar symptoms. So the fewer people that have the flu, the less inundated the hospitals will be.
Last flu season, there were 54 deaths in Clark County and 1,400 confirmed cases. More than 1,300 people were hospitalized. Kate Houston, 8 News Now.
The CDC says there is a test that can detect both influenza and COVID-19. It will be used by public health labs across the United States. The agency says it can help labs save time and testing materials, possibly returning initial results in a bit of a faster time frame. Initial test kits were sent to labs in early August, and apparently there's more on the way.